Content warning. This video discusses substance use, overdose, and contains potentially triggering content. Crisis resources are provided below. Fentanyl. What everyone needs to know. Fentanyl has become the deadliest drug crisis in American history. Today, we're going to break down what fentanyl actually is, why it's so dangerous, and most importantly, what you can do to protect yourself and others. Hi, and welcome back to my channel, and this is arguably one of the most important videos I'll ever make. The fentanyl crisis affects every community, every demographic, and every family in America. Whether you're a parent, a student, someone who uses substances, or just someone who cares about public health, this information could save lives. If this information helps even one person, please share it and subscribe for more educational content about critical health topics. What is fentanyl? Fentanyl is a synthetic opioid that was originally developed for medical use. It's prescribed by doctors for severe pain management, particularly for cancer patients or those recovering from major surgery. But here's what makes fentanyl so dangerous. It's approximately 50 times more potent than heroin and 100 times more potent than morphine. To put this in perspective, a lethal dose of fentanyl is just 2 milligrams. That's smaller than a few grains of salt. There's a crucial distinction between pharmaceutical fentanyl, which is produced in regulated facilities and prescribed by doctors, and illicit fentanyl, which is manufactured in illegal labs and sold on the street. Why is fentanyl everywhere? The reason fentanyl has flooded the illegal drug market comes down to economics and practicality for drug traffickers. First, it's incredibly cheap to produce. The raw materials are readily available and inexpensive. Second, because it's so potent, a small amount goes a very long way, making it easier to transport and distribute. Third, unlike plant-based drugs like heroin or cocaine, fentanyl can be manufactured entirely in laboratories. There's no need for large agricultural operations or specific climate conditions. For dealers, fentanyl represents massive profit margins. They can cut other drugs with tiny amounts of fentanyl to increase potency while using less of the more expensive primary substance. The contamination problem. Here is the most terrifying aspect of the current crisis. Fentanyl is increasingly found in drugs that aren't supposed to contain opioids at all. This includes cocaine, methamphetamine, MDMA, ketamine, counterfeit prescription pills made to look like Xanax, Adderall, or OxyContin. Sometimes this contamination is accidental. The same equipment used to process fentanyl is used for other drugs. But increasingly, it's intentional as dealers add fentanyl to increase the perceived potency of their products. The DEA reports that 6 out of 10 counterfeit pills contain a potentially lethal dose of fentanyl. This means people who think they're buying prescription medications are actually playing Russian roulette. How fentanyl affects the body. Fentanyl works by binding to opioid receptors in the brain, which are part of the body's natural pain and reward systems. When these receptors are activated, they produce feelings of euphoria and pain relief. The deadly danger comes from respiratory depression. Fentanyl suppresses the central nervous system, including the automatic drive to breathe. In an overdose, people literally stop breathing. A fentanyl overdose can happen within minutes of use. Signs include slow or absent breathing, blue lips and fingernails, cold and clammy skin, and loss of consciousness. Fentanyl is also highly addictive. It changes brain chemistry rapidly, and users quickly develop tolerance, meaning they need more of the drug to achieve the same effects. Recognizing an overdose. Recognizing an overdose can save someone's life. Key signs include unconsciousness or unresponsiveness, slow or absent breathing, blue or grayish skin, especially around the lips, and fingernails, gurgling or choking sounds, and a slow or absent pulse. If you suspect an overdose, call 911 immediately. Time is critical. Brain damage can occur within minutes without oxygen. Important. All 50 states have good Samaritan laws that provide legal protection for people who seek help during an overdose emergency. Don't let fear of legal consequences prevent you from saving a life. Naloxone, the life-saving medication. Naloxone, commonly known by the brand name Narcan, is a medication that can reverse opioid overdoses. It's available without prescription in all 50 states. Naloxone works by blocking opioid receptors in the brain, essentially kicking the fentanyl off those receptors and restoring normal breathing. Using naloxone is straightforward. Remove the device from packaging, insert the tip into the person's nostril, and press the plunger firmly. If the person doesn't respond within 2 to 3 minutes, administer a second dose. Because fentanyl is so potent, it often requires multiple doses of naloxone to reverse an overdose. Don't give up if the first dose doesn't work immediately. You can get naloxone from pharmacies, community health centers, and many organizations distribute it for free. Having naloxone available is like having a fire extinguisher. You hope you never need it, but it's crucial to have when you do. Prevention and harm reduction. The most effective way to prevent fentanyl overdose is to avoid using illegal drugs entirely. But we also need to acknowledge that some people will use substances regardless, and they deserve to stay alive. Harm reduction strategies include using fentanyl test strips to check substances before use. Never using alone, starting with smaller amounts, and having naloxone readily available. Some communities have supervised consumption sites where people can use substances under medical supervision. These facilities have prevented thousands of overdose deaths. For people struggling with substance use, evidence-based treatments like medication-assisted treatment with methadone, buprenorphine, or naltrexone can be life-saving. The bigger picture: the fentanyl crisis didn't happen in a vacuum. It's connected to the broader opioid epidemic, which began with overprescription of pain medications in the 1990s. Addressing this crisis requires a comprehensive approach, expanding access to treatment, reducing stigma around addiction, implementing harm reduction programs, and addressing the root causes that lead people to use substances. Communities across the country are implementing innovative solutions, from naloxone distribution programs to drug courts that prioritize treatment over incarceration. What you can do: everyone can play a role in addressing this crisis. Educate yourself and others about the risks. Share accurate information and challenge stigma around addiction. Get trained on naloxone use and keep it accessible. Many organizations offer free training sessions, support policies that expand access to treatment and harm reduction services. Contact your representatives about funding for these programs. Support people in recovery and advocate for treating addiction as a health condition, not a moral failing. The fentanyl crisis is devastating, but it's not hopeless. With the right knowledge, tools, and community response, we can save lives and support people toward recovery. Remember, addiction is a medical condition, not a character flaw. Recovery is possible, and every life has value. If you or someone you know is struggling with substance use, please reach out for help. Resources are available, and you don't have to face this alone. Please share this video with anyone who might benefit from this information. Subscribe for more educational content about critical health topics. Together, we can make a difference.